Hi everyone, and welcome to this Tutor to You live stream where we're going to do a personal statement clinic for all of you students that are applying for health and social care professional degrees, so nursing, midwifery, social work and so on. Today I am joined by Rosy in the middle of your screen. Rosy is a practicing midwife and a midwife lecturer and also admissions tutor for midwifery at Anglia Ruskin University. Hi Rosy.
Hello, thank you so much.
Thank you for joining us. And then on the other side of your screen, you've got Lynne, who you've probably seen before, regular health and social care contributor. Lynne is teacher of sociology, teacher of health and social care, and has also worked in lots of sectors, but youth justice and healthcare management. So welcome, Lynne.
Thank you. Hi, everyone.
So we are going to go through our top tips for personal statements, and then we're going to look at some example paragraphs and let you know what we think are good and bad about those paragraphs, and then we are going to take your questions. Just getting Rosy back. Hi, Rosy. Okay, so let's move on and go straight in with our top tips for personal statements. Okay, so successful personal statements have to be honest and authentic. I think that both Lynne and Rosy will agree with me there. The person reading your personal statement needs to know about you as a person. So it's really important that you don't use someone else's personal statement as your starting point or artificial intelligence, because it has to be about you. Also, a really important thing about being honest and authentic is to avoid cliches and quotations. Lynne, what are some of the common things you see students doing that are maybe not following this kind of tip?
Well, often an opening line will be something a little bit cheesy, maybe.
Right.
Yeah, so, I don't know. I've dreamt of becoming a midwife or something like that. So yeah, I think avoid those opening statements that are really cliche, because you sort of put the person that's reading it off from the initial start, really. And also quotation straight off the bat, using a quotation doesn't really reflect you. It doesn't show your passion straight off. It's kind of using somebody else's work. So very much, yeah, try and avoid that in your sort of first paragraph, really.
Absolutely.
So cheesy.
Yeah, avoid the cheese.
Yeah.
So you really do need to show enthusiasm for the course and the profession that you're applying for. Rosy, what kind of things are we looking for in a personal statement about the course and the profession?
I think it's really important that you demonstrate that you understand the job that you're wanting to do at the end of the degree, because that's what these kind of degrees are leading to, is professional registration. So it's really important that you can show that you really know what that role involves, and that you understand all the different aspects of it. So for midwifery, for example, lots of people just associate the birth as part of that, but actually the midwife's role is so much more than just facilitating a birth. So we love to see that you really understand what you're coming into and what you want to do.
Absolutely. So I see that someone's asked a question, what should I say for occupational therapy? Same rules apply. If you're applying for occupational therapy, you need to be saying why it is that you want to do that course, why you're suitable for that course, what you know about being an occupational therapist. So what is the role, the scope of practice, who's the regulator for occupational therapists, what does that mean? And then that kind of links into the next bit, which I know is a favourite area of Lynn's, which is providing hard evidence. And for that, we mean evidence of everything that you say in your statement, right, Lynn?
Yeah, absolutely. So, it's not just kind of reporting on things that you have done. It's showing actual evidence of what you've learned from those things. And what skills and how you've developed as a person as a result of that, but how that's then going to help you go on to study midwifery, nursing, occupational therapy. So you need to give real tangible examples of things that you've done, things you've read, podcasts you've listened to, books you've read, documentaries, but also trips you've been on, maybe group work you've been involved in, projects, competitions. You really do need to have hard, tangible examples of things that you've done that show your passion for that subject, and show that you've kind of gone out there to explore what that profession is about, showing that you've read beyond the things that you've learned in the classroom. So I think that's really important, particularly if you were thinking about occupational therapy. What have you done to go and find out about what occupational therapists do? Have you met with an occupational therapist? Have you had one in your school and been inspired by them? So you need really lovely, tangible examples of things, but you need to reflect on what you've learned from those things as well.
Mm-hmm. So I see there's a question from Rania, who says, when applying for a children's nursing course, could I include experience with younger siblings? What are our thoughts on that one? Maybe Rosy, do you have any thoughts on that one?
Yeah, I think that it's good to use that as inspiration. So you can talk about the fact that maybe that's inspired you to want to come into this role, and you've learned a lot by watching your siblings and being involved in their care and seeing their growth and development. But I would then, do as Lynn's been saying, follow that up with what how you've taken that forwards. So what have you done with those experiences? Has it inspired you to read more or to seek out work experience or voluntary work or something like that? So I'd use it as a bit of a springboard to talk about what you've done forwards, but it's okay to use them as your inspiration. Absolutely.
Mm-hmm. I've certainly had a student in the past who they had a sibling with autistic spectrum disorder, and they had been quite heavily involved in their care in like a family-centered way, and she was able to use that experience to talk about supporting people with additional needs. And like Rosy said, she linked that then to experiences she had with other service users and work experience and reading that she'd done around that. I think the bottom point on the screen there, a springboard for your interview, your personal statement is obviously it's the big part of your UCAS application, but it also, I think, helps you to distill and think about who am I? What skills and qualities do I have? What experience do I have? So that when hopefully you get that interview or, you know, that selection day for your course, you can draw on everything you wrote in your personal statement and expand on it and talk about it. And you could expect to be asked things that you've written about. So I think that goes back again then to being honest and authentic. You know, we shouldn't be not lying, but we don't want to overstate things in our personal statement if we can't back them up face to face with a university selection board, I think. Does everyone agree with that?
Yeah,
absolutely.
Yeah, you need that evidence to be able to, you know, back up what you're saying. Otherwise, people won't take you seriously. Yeah.
Okay, so
Definitely.
Going back to knowledge of your chosen profession, Rosy touched on some of these things, but I think it's important just to go through it again. You know, what is the primary role of the professional? One of the things that Rosy said is this misconception that, you know, midwives look after babies, but that's just a very small part of the role. So, you know, really find out for your chosen profession, what is the primary role? And every one of these professions we're talking about has a Royal College or a college, which is like the recognised professional body for that profession. And their websites will tell you what the primary role of that professional is. You want to know about some of the principal responsibilities of that professional, because you need to say how you could possibly transfer the skills you have now into that role in the future. You also need to know, you know, where does that professional work? Do they work in acute settings? Do they work in the community? Do they work in prisons? Do they work in education? Who are they working with? So who are their service users? And then particularly important, I think, is to know who regulates that profession. What professional standards do you have to meet? And actually, even what does regulation mean? If you're going to talk about those things in your statement, make sure you know what regulation means. And then, really important, don't just write these things out in your statement, because it's not an essay on what is the role of a midwife or the role of a social worker, because the university you're applying to know that. What you're doing is showing that you know it. So you need to weave that in throughout everything you say in your statement. So, you know, if you're talking about your siblings, like Rania might do, or if you're talking about scouting or Girl Guides, you know, weave in how that links to those future professional roles. Is there anything you'd like to add, Rosy, in terms of like knowledge of the profession?
Yeah, I think certainly for things like nursing and midwifery, there are so many different skills that these professionals use on a regular basis that lots of you will have experience of that you may not even realise you've had. So whether that's doing some peer support work at your school, or whether you've got a part-time job even in something like a cafe, you can still relate that to being a midwife, because you have to be able to communicate well to be a midwife, and you have to be able to communicate well to hold down your part-time job too. So think about what you are bringing, what you are offering, and how that relates directly to the role.
Yeah, excellent. I think pretty much any job can be good evidence in a personal statement, because all of the health and social care careers, they're all public facing. There's lots of interaction, isn't there? There's lots of communication. You know, you need to be punctual. You need to, you know, turn up on time. You need to be smartly dressed. You need to be maybe wearing a uniform. So, you know, if you've got a part-time job, you do those things. So it's all relevant. Okay, so thinking about extracurricular stuff, it's really important that you maybe think about some key issues or debates in the area that you're going to work in, the sector that you're going to work in. So if you want to be a social worker, what are the big things happening in social work now? You might be able to find that out by listening to podcasts or regularly checking the BBC News. I've also done a really nice reading list for you, which you'll be able to download at the end, which has got loads of recommended reads. Some are textbooks, but you don't need to go and buy a textbook. There's tons of things that you can read online for free this evening, tomorrow. You know, some things that are like little bite-sized chunks, other things a bit meatier. So you can talk about those in your personal statement, and that shows that you're really engaging with the profession. You can talk about your work experience, so that could be a part-time job, that could be volunteering, could be shadowing. It could be peer support at school. And again, you're not just writing these out as statements, you're reflecting on them, like Lynne said, and weaving them into everything that you've done. Before we move on to have a look at some example paragraphs, is there anything that anyone wants to say, Rosy or Lynne, about kind of top tips before we look at those?
There's quite a good question, actually, Liz, that I could see where somebody's asked, Charles.
Yep.
Should I discuss my long-term career goals in the personal statement? I think that's a really good idea. Don't spend ages on that and paragraphs, but I think absolutely talking about, what kind of, nurse that you want to be, or, how you see yourself in the future. It shows your ambition, it shows your drive, it shows that you're working towards something. So Charles, absolutely, I'd say make reference to your long-term goals in there. I'd also, Liz, I was just going to add, I think the Royal College of Nursing, they've updated their definition of nursing, haven't they?
They have, yes.
So, so go onto the Royal College of Nursing website and or any profession website that you want to apply for, because, they might have done things like updated their latest definition of what the role is all about. And, you'll have that most up-to-date information. So that's really important.
Okay, we've got another really good question, but I might leave that one until we've looked at the examples. I'm going to favourite it on my screen, so don't let me forget. We'll come back to it. Okay, so let's have a look at our examples. So this is an opening paragraph from a real student who applied for midwifery. She was successful, but this is her very first draft. And she presented her personal statement to me, and I had a look at it and I said, this is really great. What I love about it is that she is showing that she's motivated and that she really wants to be a midwife. And I think that's a really important kind of opening essence to have. But the bits that I've underlined are the areas that I said to her, maybe you need to go and improve on. So first sentence, my dream career is to become a midwife. That is one of those cheesy opening lines that Lynne said about, which we really recommend that you avoid. And Lynne and I actually, quite a few years ago now, we did some UCAS training. And one of the things that they said on the UCAS training at the UCAS head office is that they get loads of this, like absolutely tons of my dream career. I've always wanted to, since I was a child, just avoid those things like the plague. Because the person reading your personal statement is making a choice about whether you should be shortlisted. And if they read that, they'll be like, oh, here we go again. You need to give them something a bit more unique. And then the other thing... Liz, go on.
Sorry, Liz, I'll just say, when you're doing your opening sentence, don't write that at the beginning. Write it at the end. Yeah. Come back to it when you've done the rest of your personal statement. It's really hard to get that opening line right. Just it's the first thing you're going to write on a page.
I agree. I always do the introduction last when writing an essay. So I think same with your personal statement. The other thing I said to my student is Tales of a Midwife and Hard Pushed, a Midwife Story. They're not really, they're like, I don't know how to describe them. They're not evidence-based. They're not like academic pieces of work. They're more like popular fiction, I suppose. So I set her a task and said, go away and find something that is more academic that you can write about. Rosy, do you agree? Would you avoid these kind of sort of like novel type books?
I think so, and we see a lot of this, and we see that they are true, so they're not made up, but they're maybe one person's experience or perception of the career. So what they may well have inspired you, but it's then what did you do beyond that? And that's where the more academic books, podcasts, and websites and professional bodies really come into it. We absolutely love to see students that have gone and found those sorts of things because they really show that you're taking this seriously and that you really want to understand it. And I think that's really important. And the same goes for things like social media. Social media is a fantastic platform to help you learn about things, but that's your first step. What you then need to bring into your statement is where you've taken that. So if you're inspired by a podcast, what kind of podcast was it? What did you go on and read about, and follow it up to show that you have really researched it rather than just going off of one person's idea.
Yeah, thank you for explaining what I failed to explain about those books. The other thing that I said to this student is she needs to be careful of the language that she's using. So she talked about woman-centred care for every baby, which obviously that doesn't quite work, because woman-centred care doesn't centre on a baby, does it? It centres on the woman. And also she talked about medical practice, and midwives don't practice medicine, they practice midwifery. So we have to be really careful about the language that we use, because it can maybe show that we don't know the role of the profession as well as we think we do. So be careful of that. But I think Rosy would agree with me. You're not already a midwife or a social worker or a nurse. You're going to university to learn that. So it's okay if you make some mistakes. No personal statement is going to be perfect. And maybe that's what, makes it more you, is that it's not perfect. Someone said, how would you start the opening then? Well, you'll be glad to know. This is where the student ended up after multiple drafts. Something that I think is really important for you all to know is that you won't do 1 or 2 or 3 drafts of your personal statement. You might do 10. And I know that sounds a bit scary, but that's how many drafts a lot of students are doing. The other thing to think about is you're going to ask people to give you feedback, but don't ask 5 people all at once to give you feedback, because they'll all tell you something different and then you'll be really confused. So I think choose 1 or 2 people and then ask them one at a time. So if I wrote a statement, I would give it to Lynne and ask for her feedback, take her feedback on board and may or may not make changes. And then I might say, right, I'm happy with that. And then I might give it to Rosy and then she'll give me her feedback and then I may or may not make changes. But if you give it to lots of people, you'll just get confused, and then your personal statement will also be less about you and more kind of a mismatch of everyone's idea about how it should be. So you can see on this example on the screen, the student didn't massively change their opening statement. They just didn't say the cliched, I've always dreamt about being a midwife. It's, I am strongly motivated to become a midwife. They've then referenced a more academic work. Squaring the Circle is, it's kind of like a textbook, I guess. It's evidence-based midwifery. They've changed their language. So we're talking about women-centred care, supporting women, and then they have linked what they learnt from the book to why they want to be a midwife. So they're saying, I've learned that providing women in families with choice and control improves outcomes, and they would relish the opportunity to empower women. And what I really like about what the student did there is that they're showing that they understand the role of the midwife. Key part of being a midwife is empowering women. It's also having nice, safe outcomes for women and babies. So, they're in their first paragraph, they're demonstrating that they really understand what they're doing. Anything that you want to say about this, Rosy, being as it's a midwifery example?
Yeah, I think it's a really lovely example, because you're right. There's still personality in this. We can still see who this individual student is, and they've managed to demonstrate that they know what it means to be a midwife without just making a statement, as you were talking about before.
Okay, just having a look at this question. So someone is saying at their school they have to send their personal statement to the teacher that teaches the subject that relates to the degree we are applying to the most. Yeah, I think that's quite common. When I was working in a secondary school a few years ago, I used to get all of the midwifery statements sent to me because I was at one point in my life a registered midwife, and I also got lots of healthcare degrees like nursing and paramedic personal statements coming my way. I think it's really important. However, I do think it's quite nice to get someone totally different to read it as well, because if that totally different person gets to the end of your statement and says, oh wow, I know about the role of the occupational therapist or the social worker, and I can see how you would be suited to that, then you've written an amazing personal statement. So maybe consider that as well. Let's have a look at our next example. Okay, so we'd said that you can link to work experience. So this student was applying for children's nursing and they have written this paragraph. So they're talking about working in a special educational needs school and gaining transferable skills such as empathy and active listening. They say, I learnt to understand children's emotions as well as interacting with them and helping with their schoolwork. Each week was different as there were challenging situations which will help me with nursing, which is sometimes difficult. For example, dealing with death and dying. So Lynn, how well do you think this paragraph is linking this student's work experience to being a children's nurse?
I think it's okay. I think there's, an attempt there at the second part where they have tried to say, I've done this, so therefore this will help me when I'm doing nursing. I think maybe they could have drawn out a bit more in terms of the empathy and active listening skills and linking to the why they are kind of useful when you're doing nursing. But I think it's not too bad. It's a kind of a good example of a piece of experience that they've done working in a special educational needs setting. I think that's something tangible that they're sharing.
Mm-hmm. Yeah, for me, I think there's a tendency with students who have had a really good experience like this to just tell you everything they had, like everything about that experience. So I did this and I did this and I did this and I did this. Whereas sometimes I think if they focus down on maybe one or two and really drew it out. So for example, this student, I'm like, okay, well, how did you learn to be empathetic? Like, what is it that you did to show empathy? Like, how did you use active listening skills? Because from what they've written now, I don't know that they actually know what those things mean. I know that they found them and thought, oh yeah, they're relevant, but how did they do them? And then how would they use them in nursing? Do you agree, Rosy?
Yeah, definitely. And I think it links to what you were talking about before, with your personal statement then being a springboard for your interview, because it's like you say, it's okay to talk about one element of what you've learnt in a work experience situation, because you can bring the other things in at your interview. Mm-hmm. You want to give people an idea of what you've learned, and like you say, that you really understand the terms that you're using in your statement, and sometimes fewer examples will help you achieve that.
Yeah, I agree. Okay, let's have a look at our next one. So this one is linking to your school subjects. So I'm sure that we have students that are listening right now that are maybe doing BTEC Nationals, some might be doing A-levels, some might be doing a mixture, some of you might be doing T-levels. So you've all got slightly different experiences of what you've studied, but in every case, regardless, I think, of what subjects you've been studying, you can link them to university and the course that you've chosen. I'm not going to read this one out, but Lynn, we've got a student here applying for occupational therapy, and they've talked about anatomy and physiology for health and social care, linking to supporting people with physical disabilities, and then talking about working in health and social care and professional accountability and regulation. Do you think the student's done a good job?
Yeah, not too bad. I mean, I think it's good. They've pulled out the more relevant subjects that they've done within health and social care. So it's the topics, and they've, said that these are the two main topics that are going to help me the most. Yeah. So I think that's good. I think maybe they could have just drawn out particularly something they have done of particular merit, maybe within each of those topics. And then, so because they've just sort of reported on the fact that they've studied it, and then they've made a quite a nice link, but they could have said, oh, I wrote an extended essay on this aspect, which then linked to this, or we had a guest speaker come in who then made me link to this. So it's more not just reporting on the topics that you've studied, but more, what have you done of note, of merit? Have you done a group work project? Have you done something specific? Or did you take your learning beyond the classroom? So working in health and social care was a topic that then inspired me to go and take my learning beyond the classroom. And then I was able to do this, gain a day shadowing somebody, for example. Yeah. So I think it's a really good start, but just thinking, have I kind of really shown myself a bit different to other people who have also sat in the class and studied these subjects? Yeah.
I think the thing to remember as well is what I see a lot of students doing is they say, I did a level 3 extended certificate and blah, blah, blah. We know that it's on your application. You've written down your course. If you've done health and social care, for example, you've listed your modules. If you've done a T-level health, we know what course you've done. You just need to tell us how little snippets are relevant. Lynn, do you think it's necessary to always link to the subjects that you've studied?
So how do you mean in terms of reflecting back on what you've done?
Yeah, so if there was a statement that didn't talk at all about what they'd studied at level 3, do you think that would be a mistake?
I mean, I think if you, are applying for health and social care and you might have done sociology, psychology, and another third subject, economics, for example, and it's not necessarily relevant, you don't necessarily need to cover off absolutely everything. Like Rosy says, hold some things back. You can talk about them. Again, you can talk about health and social care economics when you're in an interview if it's relevant. So I think if you look at this example on the screen, this is where a student has linked that they've studied sociology and that they've studied psychology. This is great. What they've done is they've tried to pull out, I've done these topics, and these topics are really useful, and this is how it would relate. But I think a lot of the students who also studied sociology and psychology have also done these topics. They're kind of the standard topics that everybody studied.
Yeah.
So it's kind of narrowing down, like I said before, really, what have you done specifically in sociology A level that kind of is a bit different to maybe somebody else, or how have you excelled with that? I think that works really well. And I do feel if you look at this example, it's a little bit listy. So some of the things they're listing, I've learned this. And actually, if you could narrow down more on maybe one of the things that you learnt. So, for example, I think in the first paragraph, it says social work requires an in-depth understanding of factors that can affect people's circumstances, such as health, economic status, identity, and discrimination. Actually, that's quite listy. And perhaps it would have been better to talk about, one thing I've really noticed is that social work requires an in-depth understanding of discrimination because of the need to have anti-discriminatory practice in the way that they work. And I saw this in a work experience placement where we really valued everybody's contribution in a certain way and give an example. So sometimes narrowing down to one area and giving a little bit more depth can actually add more value than just like listing literally everything that you've learned. I think that's important.
Definitely agree with that one. Okay, let's go to then extracurricular. So Rania has asked about skills. Can we, for example, talk about being able to speak many languages? I'll answer that one first, I think, Rania. I think being able to speak many languages is a fantastic skill, and in health and social care, really, really useful. I think what you need to do is what we've been saying throughout. If you want to talk about that, link that to how you would use it on your course as a student and how you would use it in professional practice. So don't just put it there as a throwaway. Like, what would you do with it? Why is it important? If we have a look at this paragraph on the screen, this student is telling us about scouting, being a prefect, sixth form open evening, gospel choir, young carer health champion programme, so many things. And I'm left thinking, wow, okay, I want to know about all of them in more detail. Obviously, there's not enough space for that. We've got a limited amount of characters, haven't we? So I would recommend, and I did actually recommend to this student, pick one or maybe two and just tell me more about them, make them more relevant. So let's have a look at the improved version that the student gave us. Okay, so this bit focuses on scouting and how being a scout helps that student, has shaped that student and makes them suitable for being a paramedic. So they've talked about stress relief, managing the demands of study and work placement. I think it's really important that you guys know what you're letting yourself in for a health and social care professional degree. It's not like other degrees, and that's why we're here talking about your personal statement, because everything about doing a health and social care professional degree is different. Your statement needs to be different because you're essentially applying for a profession as well as a degree. And when you go to university, you are going to be juggling practice, so placement, and university. You're going to be doing many more weeks of your year than your friends doing English literature, for example. So showing that you understand that in your statement is a great thing. Do you agree, Rosy?
Yeah, absolutely. It's really, really important that you demonstrate that you understand what you're bringing yourself in for. I mean, obviously, I think midwifery and also lots of the other things that we're talking about are fantastic careers. They're amazing, and I love it. And I love my job, but it is demanding and it is challenging. So showing how you are going to rise to that challenge is an important part of this, and helping us to see that you really do understand it. And that's what's going to make you a successful student.
Absolutely. So we'll just quickly look at this and then we'll go to questions, because I see some really good questions. So this student then talks about some of the skills that they learnt from scouting, problem solving, prioritisation, linked that to what paramedics do, and then also talked about how in Scouts you meet lots of different people, diverse cultures and beliefs, and Scouting has quite an inclusive philosophy. It's very much about respect and dignity and including everyone, which are also NHS values. If you're applying for a role where you may work in the NHS, really important, I personally think, or we'll ask Rosy if she agrees, to have something about the NHS values in your statement. If you're applying for nursing, you probably also want to try and squeeze in the 6 C's as well. Rosy, am I on the right lines there?
Yes, definitely. We love to see that. It shows us that you've done wider reading and research about it. But I think it's really key that you do it in a way that we've talked about already, and that this student has done, is don't just tell us what they are. You know, we know what the 6 C's are. Tell us how you are meeting them. Okay, so what have you done? What are your experiences that are showing that you are going to embody those values in your practice as a student paramedic or a student nurse?
Brilliant, thank you. Okay, I'm just going to show you briefly the rest of the PowerPoint. So I have given you links to all the professional bodies and also statutory regulators. I will put the PowerPoint onto the Tutor2 website at the end of the live stream so you can download it. But let's go now to some of these questions. So, got John's little test one there. Where is my one? Here. Okay. So, I was thinking about also applying for health and social care at uni. So, I think this is the person that wants to apply for occupational therapy, I think. Yes. How do I make my personal statement balanced, as I do want to do occupational therapy, but health and social care degree as a backup? I'm going to ask maybe Rosy about this one. So obviously, Rosy, you're admissions tutor for midwifery. What is your university's take on if someone writes a personal statement where they're hedging their bets between kind of maybe two degrees or 2 professions? Does that sit well or not?
It can sometimes come across as slightly confused, that you're not quite sure what you want to do. I think it's okay to not be sure. Yeah. However, as we've talked about, these are really challenging degrees that you're doing. So we want to know from an applicant that they are prepared and ready. It may be that you can provide more than one personal statement if you're making a fresh UCAS application in the at a different point, if you're changing your mind and so on about what you want to do later on down the line. So I think it's not necessarily impossible, but it may be harder to put both things into one statement whilst demonstrating your clear kind of commitment to one or the other.
Yeah. I mean, what I would say is applying for occupational therapy, you want to make your statement, if you want to be an occupational therapist, I personally think your personal statement should say everything about occupational therapy. I would perhaps, I'm not sure, but I wonder whether if you applied for 4 occupational therapy places and 1 health and social care degree, you may get the offer for the health and social care degree and the occupational therapy. In which case, as a student, I would take the occupational therapy as my firm choice and health and social care degree maybe as my insurance, and take it from there on results day. Because it's my understanding that a health and social care degree is easier, essentially, to get a place on than occupational therapy. So that could be something that you could do. However, the other option is that there is clearing. So you could do your 5 choices for occupational therapy, and then on results day, if you don't get the results that you need for occupational therapy, you can go into clearing and find a different course, whichever you like. Rosy, clearing is quite a well-established system, isn't it? I know that every university takes students, even for health and social care degrees, through clearing, don't they?
Mm-hmm.
So,
yes, yeah.
Yeah, so I would say to that student, sweets, sitting at home, do some research, find out what clearing is if you're not sure. Talk to your school, your college about clearing. But I personally, if I was you, I would, if so long as I'm doing the right courses to get into occupational therapy, I would be applying for 5 occupational therapy places. Everyone's nodding.
Yeah, and I was
go on
going to
then.
say, Liz, I think if you don't get any offers, if you don't get any offers at all for the occupational 5, I think you can add some more to your pool and go and then apply to a few more before clearing if you don't get any offers at all. So and you may be able to adapt your personal statement at that point.
Great
Just check
advice,
on that,
Lynn. Yeah, the UCAS website will tell you everything you need to know about
It
these
will.
things.
It's quite clear on that, yeah.
Yeah. So we've got a question from Dylan, which is very similar. How could you make this less specific, as your personal statement can get sent to 5 unis? For example, if you equally wanted to be 2 different health and care practitioners. Dylan, I think we're all going to say the same thing here. I think you need to
choose.
Yeah, you need to do some research and decide which is the right one for you. I don't know what you're making a decision between. I guess if it's nursing, there are different types of nursing, aren't there? So that would be less concerning to me if you weren't sure exactly which type of nursing you wanted to do. But if you're thinking about, do I want to be an occupational therapist or do I want to be a midwife, then those are really different. So I think you need to do a bit more research and kind of finalise your thoughts. You could visit universities. I think there's still open days going on, taster days, things like that. There's tons of videos you can watch on all the university websites. Some of them do virtual open days. Just really do your research, I think. Anything, Rosy, that you would say about that?
Yeah, I was going to suggest open days and, going to the universities, contacting them. Often universities will have student ambassadors who are studying that degree on their open days or their virtual open days. So actually get the opportunity to talk to the people who are doing the course, the people that will be teaching it and the people that are studying it, so you can really make a decision. And we do see that on open days, that we have students that are visiting multiple courses within our faculty of something like health and social care. And it's okay to do that and go and find out. And actually it shows that you are really preparing yourself.
Okay. So Eloise has got a question. How do I link my physiotherapy work experience I observed rather than built up skills? So Eloise, observation is brilliant, and I don't think we would expect you to be doing anything other than observing in that kind of placement. Also, you're not supposed to be a physiotherapist already. That's what you're going to university to do. So what I would want to see in your personal statement is, what did you observe in that placement that really interested you or surprised you? Why did it interest you? Why did it surprise you? Where are you taking that? Anything you want to add, Rosy, maybe?
Yeah, I think that's really key. I think the fact that you've had that work experience is already fantastic. Lots of people that are applying for these courses don't have those opportunities, particularly still in a post-COVID world. It's quite difficult to gain them, and some areas of health and social care, it's very difficult to get direct work experience. And if you do, it's often observational. So yeah, I think what really inspired you? Was there one particular element that you saw that you then went and did some more research on? How did you, if you maybe worked in a sort of, you watched them doing some physiotherapy for recovery post-injury, for example, is that something that you thought was really interesting? Or maybe you observed physiotherapy for inpatients in a ward environment. There's lots of different things that you might have seen. And then where did you take that? So what else did you read? What else have you learnt that you shows that you've not just done it, but you've used it?
Excellent advice there. Okay, so we've got another one here. Do you have to add something about yourself without linking it to the subject that you want to do in uni? Not quite sure exactly what you mean. So I think it's really important to give a little bit of yourself in your personal statement. So universities, obviously, they want to know that you're up to it academically, but they also want to know that you're a well-rounded person and that you're going to contribute to university life. So I think if you've got things that you can talk about, definitely talk about them. I know that students sometimes go, oh, but I haven't done anything, I'm not interesting. But there will be something. And if you can't think of something, ask your mum, your dad, your sister, your cousin, your personal tutor, your friends. And they'll say, oh, you should definitely talk about X, Y, Z. There's always something. I think it's important that you always link it, if you can, to what you're going to do or to university life in some way. I think that answers your question. Let us know if not. Let's have a look at this one from Rania. Okay, can we list a few achievements and only explain 2 in depth and speak about the rest during the interview? Yeah, so it is tempting, isn't it, to make our personal statement into a CV and have a long list of amazing things that we've done. Ranya's obviously got lots of fantastic things to talk about, which is really nice. Just remember, Rania, that you don't have a lot of characters to use. So I would say if you've just put it in there as like a throwaway bullet point and you haven't said anything about it, take it out. Literally just tell me 2 things in depth. That has more value than giving me a list of 5 things. Everyone's nodding, so I think they agree.
Liz, I was just going to add, if you don't feel like, there are people that are probably sat there going, oh, I don't know whether I've got lots of things to say, and I don't know whether I've had that many experiences. And like you said, speak to people around you because they'll remind you of things that you've done. But also your school will be trying to give you opportunities. And, very early on, schools are, saying to you, you need to be thinking about your personal statement. As soon as students start year 12, I know the school I was in, we were very much saying, you need to be thinking about what you can do this year to enhance you as an individual. You need to be thinking about volunteering. You need to be thinking about work experience. And schools are doing that so that you're ready when it comes to the autumn of year 13. And so you've got things to write about. So, there's still time to do things. There's still time to take up those opportunities. And, on your school teams or on your school notice boards, there will be opportunities that your head of sixth form will be creating for you. They'll be making local links with local food banks. They will be making links with local charities, and really try and take advantage of those because they're there for you to develop skills that you might not have already done. So, the support is there. And if you're really stuck, go and talk to your head of year or your personal tutor at school, and they'll help you come up with some things that you can do.
Brilliant advice. Thank you, Lynn. I'm just going to skip to this question from Olivia. How can I link work experience at a primary school with courses such as social work or youth studies? Lynn, do you want to have a go at that one?
Yeah, I mean, I think it's like anything that you've done. You reflect on what you did in the work experience and you reflect on what you learned from it. And did you learn more knowledge about a particular career as a result of that? Or did you learn skills that you know that you would be able to transfer into becoming a social worker or becoming a nurse, for example? So I think Rosy was talking about, the 6 C's or, the care values that underpin any of these professions. So what did you learn in that work experience that you could then link to those particular values? So it's just trying to make the link. Any experience you've had, just sit there and brainstorm in a big bubble. What did I learn from that experience? And just come up with, things that you've learned, and then think, right, which of those can I link to my chosen career, and how can I make a nice link there? Because they want to know what was the outcome of that work experience, what was the impact of what you did. And absolutely, even if you were there just observing what was going on, how did that provoke your curiosity for health and social care? How did it make you question what's going on in the health and social care world? How did it make you realise that maybe there's a resource crisis going on, or that there's a shortage of staff and things like that? Really show that you want to find out more about the sector, and you want to really unpick those issues that everyone's facing at the moment.
Brilliant. Okay, so a question from Catherine. Do you have any academic midwifery book recommendations for personal statement?
Loads.
So, Catherine, I have produced a reading list, and I will upload it to the Tutor2 website after the live stream. There are some books on there. I haven't put loads of midwifery books on there because academic textbooks tend to be expensive, and it's unlikely that your school library or college library has them, although I would encourage all of you to ask your librarians to get a couple, because it will help you and future students. But also what I've given you on that reading list is some kind of examples of academic research that you could read with some plain English summaries, and also some podcasts and some key reports actually in the midwifery, which would be really helpful as well. So lots of free things to read as well. So definitely look at that. I spy a student that I know, and I think Lynn knows this lovely student as well. Hi Zara, hope you're well. So Zara says, I want to apply for an apprenticeship. Should I include or structure my personal statement any differently, or include anything different to increase my chances of getting accepted? Zara, I think your personal statement for an apprenticeship should be pretty much the same as it would be for a traditional degree. You could potentially talk about how you prefer to learn through experience. That might be relevant. I don't know what apprenticeships you're applying for, and I don't know if that would change what you would say, because sometimes you need to apply for a job first, and then when you're in the post you then apply for the apprenticeship, so that might be a little bit different. But yeah, feel free to ask another question to clarify that, or you could send us an email.
Yeah.
Just having a look at some of these others. Okay, here's a good one about social work. So, struggling on a personal statement for social work and what you need to add. So, it's exactly the same as we've been saying. You need to demonstrate that you know what the role of a social worker is, maybe talk about things that interest you about social work. Tell us about your skills and qualities and how they link to social work. There are lots of recommended reads on the reading list for social work that I have been researching today. Some really fabulous podcasts actually for social work. Some really interesting stuff about being anti-racist, for example, which is highly topical at the moment. So if that's something that maybe interests you, that's something to explore, I think. But yeah, everything that we've said before applies to social work. Janae,
I was just going to follow up on that just before we move on. Okay, yeah. I think it's really important that you just get started, because your personal statements, like Liz has said, you're going to do multiple different drafts. So actually just write some stuff. Sometimes it's much easier to build on it once you've got a few sentences down on paper. So it's okay to start with statements about what a social worker is and then build from that. So I would just say get something down on paper, talk about some of your key things and what a social worker is, and then build out from that. And don't expect to write a perfect one straight away.
Yeah, really sound advice. I think people get a bit paralysed, don't they? They sit there with a plain white sheet of paper and think, I don't know what to do. Just write things down, like Rosy said, and then build on it from there. Okay. Janaid says, I'm thinking to do childcare. I like working with young people. I don't know if I have the passion for it. So something that you might want to consider is maybe, before you commit yourself, is getting some voluntary experience with children. I think it's really important to say that I know there's an expectation that everyone goes to university straight away, like you finish year 13 and then you go to university, but that is not the only way to do it. You can take time out, you can work while you decide what you want to do. You can even go to university and change your mind and leave or switch to another course. I'm very mindful that you're all very young, and that you maybe don't know exactly what you want to do. And it's really hard to know what you want to do when you haven't had experience. And that has been made extra difficult for you guys because of COVID. So I think if you really don't know what you want to do at university, you don't need to apply to go straight after year 13. You've got time to think about your options, get a job, explore things, and see how it goes. So yeah, I think only you know what you want to do, but you don't always know, if you see what I mean. Okay, so someone's asking us, how would I show that I'm passionate about midwifery that would make me stand out in a way? Let's ask Rosy.
I think it's really going beyond what a midwife does on a day-to-day basis. So we know that they facilitate births, they support antenatal care, they support postnatal care. So really, what kind of things, one of the things we like to talk about in midwifery is our philosophy. So our approach to giving care. So the idea of being women-centred or birthing person-centred, the idea of empowering people, being their advocate during what is a very vulnerable time. Those sorts of things really show that you have a deep desire to make a meaningful impact on the lives of women, birthing people and their babies. And I think that that's something that's really, helps you to stand out. And I think one of the things that Liz was talking about as well, things like very topical issues and current reports, what you're saying about anti-racism and so on is a really relevant topic in midwifery as well. So go and read about those sorts of things and talk about them. Why do they make you want to be a midwife? When you read a report, for example, I don't know if on your list is the Ockenden report potentially, it talks about things like compassionate midwifery care. When you read something like that, why does that inspire you? How does it make you want to make a difference within the profession that you're applying for? And I think that helps you to stand out, because it shows not just that you want to do it and that you've got the skills to do it, but actually why and what difference you can make to people's outcomes too.
Brilliant. That's really good advice. We've got 2 questions from Alima. So her first one is, she wants to apply for a health and social care degree and working with children and young people and families degree. So can my personal statement just be about health and social care overall? Lynn, what do you think about that one?
Oh, well, I mean, I think it's similar to that question that we've had before, isn't it? About there's kind of probably 2 things that I want to do and I don't know which one to focus in on. I do think it's about thinking about which one you really, would be your preference and putting your personal statement to focus in on that. Because then if you get offered places on that, all great. If you don't, then maybe you go back and have a look at your personal statement. And then if you don't get any offers, I think you can add other options and then maybe adapt your personal statement to then children and young people, or you then go and look through clearing. I think these kind of broader degrees that are less profession specific, I do think they are easier to get in because they don't have such limited numbers in terms of placements and things like that. They're more kind of filling up larger lecture theatres and things. So I do think you are more likely to get an offer, and you might get a sort of slightly lower offer as well. It might not be so quite as competitive as getting into, child nursing at King's or somewhere like that. So I think you really try and narrow down for the one that you want. I do think that. And then there are other options. If you don't get offers, then you just go down the other routes, and do have a good read of the UCAS website about that. Yeah, but you can't keep hedging your bets, people. Come on, pick one.
Absolutely.
So Alima's other question is, can you do a degree apprenticeship in midwifery? I will answer it before we go to Rosy. So Alima, yes, you can. But I think in all cases, you probably need to have a job as a maternity support worker first, and then you apply for the degree apprenticeship kind of like in collaboration with your employer. I know that Greenwich University does it. Rosy, I don't know, is there any other universities doing the apprenticeship yet?
Not yet, but Anglia Ruskin, for example,
Brilliant.
we are planning our degree apprenticeship currently. And Liz is right, the pathway into that will probably be slightly different in that you would need to have a job and you'll need to be potentially interviewed by the trust as well as by the university. So the process for getting in might be slightly different. A job as a maternity support worker is a really excellent thing to have to help you, but often those are not compatible with studying in year 12 and 13. So it might be that you're, as part of your gap year, for example, or your time out, if you're not ready to go straight off to university, getting a job as a healthcare support worker is fantastic anyway for any health and social care degree. It gives you a really brilliant introduction to all sorts of different professions within it. Maternity support worker jobs can be a little more competitive. So you might have to start with healthcare support worker and then move into it. But you're right, the route of that degree apprenticeship will be slightly different. But it's definitely a budgeting area of midwifery.
Yeah, a really great route, actually. Okay, so I'm conscious that we're over time, but let's try and get some of these questions done. So Annette is asking about wider reading for diagnostic radiography. So I have done my best to add some radiography reading to my reading list, but there's loads of things on the reading list that apply generally to healthcare workers. So Annette, give me about 10 minutes after we finish to upload it to the website, and then you can download that link. Another one from this lovely person. How can I link my work experience of working in a children's centre to my personal statement when applying for social work? Oh, you must have loads that you could say about there. So I would be saying things like interacting with children and their families. So did you do that? What communication skills did you develop? What did you notice about the way that the staff interact with children and their families? Did you have to look at any policies while you were there? Did you have to sign anything about safeguarding? I'm certain that you probably would have had a DBS. Why did you have a DBS? What's the relevance of that? You could talk, you can talk about anything that you did there and it would be relevant to social work. What activities did they do at the children's centre? Was there signposting to other services? What professionals came in? You probably saw, there's probably a timetable of events at the children's centre that you can go and look at if you've forgotten. And it might have, different drop-in clinics with different professionals. So you could talk about multi-agency working, multi-professional working, loads of things there. Let's try and get some more. Junaid, where can we volunteer during the half term? I don't know, Junaid, I don't know where you live, but I'm sure you could find something. Ask your school or college to help you if they've got any ideas. If you've got a community centre where you live, go to the community centre, ask them there. If there's any local food bank, any local charities. So I'm trying to think, MenCap, often, for example.
Nurseries. Nurseries often are quite happy to have students, actually.
Yeah, maybe residential care homes. Might still be a little bit tricky with COVID, I'm not sure, but sometimes they're, can be happy to have people in just to make the tea, have a chat with the residents. Okay,
and maybe speak to your school for some advice as well.
Definitely.
Yeah.
Okay, so Dylan said, what's something that really helped someone with their personal statement? Like, what made you as an admissions person go, that will be a perfect match for the course? Okay, I think what Dylan's after here, Rosy, is what is your criteria? What are you looking for in a personal statement?
So we are looking for essentially everything that's been in this presentation. So we want to know you understand the profession and the course you're signing up for. These are tough courses that you're planning to do. We want to know that you can go the distance and that you will be successful on this course. We want to know what you have done and how it is relevant. So your transferable skills. So what have you learned and how is that going to help you? So don't just tell me you've got good communication skills. Tell me why you've got them. What have you done to develop them? And how will that help you in your chosen profession? So you sort of make you make your statement and then you follow it up with how you got it and then what you are going to do with that. And if you do that, your passion and your enthusiasm will usually shine through in that statement. And I have to say, the other thing that we want to see is spelling, grammar, punctuation. So proofread your personal statements. Your tutors at school will be able to help you do that and so on. But it also makes it look like, yes, you put time and effort into this statement. And that's a really fantastic thing to see. And link your wider reading. So what have you learnt from your reading about the professional registration, the regulatory process, those current topics and debates? Show us that you've not just picked a course at random.
Okay, we've got a really good question from Sophie. So she's got two questions, but I'm going to put one on the screen. She's saying she's currently writing her personal statement for midwifery, but she's struggling to sell herself. And her key question is, how can she relate her life experiences without sounding like a story? Which I think is a really good question. Rosy, what do you think? So this is a person that's had some experience, they've got children, they've experienced miscarriage. How can they talk about themselves in that way without telling a story?
So I think that you can use lots of terms like inspire and, things like that. So those sorts of experiences they're really important. But you don't necessarily, like you say, want to just say that these happened to me. So it's then, what have you done from those experiences? How has that made you want to be a midwife? So, for example, having children of your own, what was it about the experience of having children that has made you think that midwifery is the career for you? So maybe you had incredibly supportive midwifery care and you want to be able to provide that to other people. Or maybe you didn't have such great care, in which case, how has that made you want to make a difference? So I think it's similar to what we were talking about before, really. It's use the experience, but that's the briefest part. The bulk of what you're going to talk about is where you've taken that experience. Did it lead you to read more about maternal mental health, for example, or pregnancy loss? And where did you get that from? So think about charities, think about, national governmental reports. What did you go and read? Because what we want to see with life experiences, and this goes for everybody, is that you're not basing your understanding of the profession on something that's happened to you. So I saw my mum have my sibling, fantastic experience, but we don't want you to base your personal statement just on that, because you'll only have seen a small part of that process. So use it as inspiration and then use the bulk to tell us where you've taken that.
Yeah, brilliant. Really good advice. One of the handouts that's in the download that you can get afterwards is the STAR method. So that kind of gives you a structured method for talking about a skill or an experience that you've had and how you can focus on like the reflecting part, the action part of it. Ranya's asking, are there any academic texts for children's nursing? Yes. Do have a look at my reading list. This student is saying, is midwifery really as competitive as people say? Should I be worried that I won't be able to get into a uni? Rosy, what would you say to that one?
I would say that midwifery is such a separate and distinct profession to nursing. There are some crossovers, but they are very separate. And there are fewer midwives than there will be nurses. So you will always have smaller cohorts and therefore more competition than some other places, because that's just the nature of the way that we use the services within the NHS. I don't think that you should be worried. Okay, I think if this is what you want to do, then you've got to go for it, and that's where using the advice that we've got from sessions like today would be really helpful. I think one of our key take-home messages as a midwifery admissions tutor that I want to see in personal statements, but also at interview, is that you have really researched this. So you know exactly what you're doing and why you want to do it and why you would be amazing at it. So that's the sort of thing that we want to look for. And I say just go for it. And sometimes it does take people multiple attempts to come into midwifery, and people have to apply more than once, and don't let that put you off. Okay, it just means that when you do get here, you'll be so passionate and motivated that it'll give you a real drive.
Yeah, and I was just going to add, don't waste any of your sort of 5 choices. So make sure that you're applying for universities that very much match your predicted grades or what you expect to be doing. So, you might be more likely to not get in because you're not applying for the universities that match your level of qualification. So make your choices really sensible in terms of what you're where you're applying to.
Okay, I think we've got quite a few questions. Let's see how many we can get through. Is everyone still okay to carry on?
Yeah, we'll plough on, yeah.
Okay, so I've only ever done volunteering at charity shops. How do I link that to radiography? Okay, so if you've worked in a charity shop, you have used your communication skills. You have talked to people. You have made people feel at ease. Radiographers have to do that. You have to talk to people as a radiographer. You have to make people feel at ease. So there you go, there's a quick win there. I would imagine that you had to turn up on time and that you were responsible for things while you were there. Radiographers have to turn up on time. It's a very responsible job. It seems a little bit flippant, but it really isn't. Any experience that you have of working with other people, being responsible, interacting with the public is like gold dust for health and social care professional degrees. Rosy's nodding. Anything else that you can think of just off the bat, Rosy, about working in a charity shop?
Yeah, I think, organisation, the team working that you'll have done with the other volunteers, and with the main charity. Maybe you've been involved a bit more than just turning up in the shop, or maybe the focus has been on the time that you're spending in the shop itself. So, what kind of skills are you picking up in terms of organisation? There's heavy workloads involved with a lot of these degrees. So how are those skills going to help you to balance placement as well as academic study? And those sort of organisational skills are really important as well. So I would just take everything that you've got and sell it. You'll have fantastic experiences that you will be able to sell.
Yeah, I was just thinking as well, like NHS values, commitment. Well, volunteering in a charity shop, that shows commitment. So, link that to that NHS value, dignity, respect. I would imagine that you showed a lot of respect to the people that came into the shop. There's loads that you can do with it. So you just need to think outside the box a little bit. Zara is saying, what websites or places do you think is best to research for healthcare careers? So Zara, NHS Healthcare Careers, have you been on that website? It's amazing. I think there's like 350 careers in the NHS, so it'll take you a while to plough through them all. I think there's a quiz as well that you can do, which kind of tries to match your interests and skills to different careers. So have a look at that. It's a really good website. They also have really good social media as well, actually. If you're on Instagram, Zara, follow NHS Healthcare Careers. They do loads of Instagram lives, recorded videos. They're all the time, there's stuff on there, and they're really responsive as well. If you ask questions, they get back to you. They're really great. Alima's saying, how do I make my CV stand out? So Alima, you can add a little mini personal statement to a CV. I don't know if you submit a CV and a personal statement for an NHS apprenticeship, but just do what we've been saying. What skills do you have? What are the NHS values? How have you embodied them? Try and get that down. Another student that we know, Lynn, Zara Almamar. So nice to see two of my lovely teachers. Nice to see you too. Someone is asking, okay, really good question. Would taking a gap year set me back? 100% no, doesn't set you back at all. In fact, you could grow massively as a person in a gap year. You could get work experience that could support you. It could change your mind about what career you want to do. It also means that you're in that perfect position of knowing exactly what your grades are when you apply, which is really nice as well. So no, gap years do not set you back. Zara A is asking, do all midwives complete 12-hour shifts? Rosie, do you want to answer that one?
I would say the vast majority, and definitely during your training. It will depend on the hospital at which you are placed. So all different NHS trusts have different shift patterns and ways of working. So if that's something that you're particularly worried about, you need to look at the university that you're thinking of applying for, but which trusts will they send you to for placement, and then find out from that if you're too worried. But yes, the vast majority of us do. One of the reasons why it's so important is that it means that you really get to develop a relationship with the people that you're caring for, rather than doing short shifts and chopping and changing. You may well work for a trust that has short shifts as well, but no, most of them you're signing up for 12 hours, night shifts, weekends, right from the off.
Okay, Jamie is asking, haven't had work experience in primary school, but this is where I'm looking as a career path, but I do have younger siblings. Lynn, do you want to give some advice to Jamie on this one?
Yeah, sure. So I think we had a question earlier on, didn't we, about younger siblings and kind of how that's helped. So I think Rosie talked a bit about how, that's inspired you. So, to want to go and do teaching as a career and a profession. And again, just drawing out skills that you have, that when you interact with younger siblings, you're able to show a caring, empathetic side, that you're able to inspire younger people to, engage in activities and things like that. So drawing out what it is that you've done. I know you haven't had experience in a primary school, but can you try and, talk to a primary school teacher perhaps and ask them about the role, try and get a really good understanding of what the role is about. And you could talk about that in your CV, that you had the opportunity to talk to a primary school teacher that was maybe head of Key Stage 1 or, early years or something. That's also another easy way. I'm sure your family have got friends who somebody in there is a primary school teacher. They're everywhere. So, or even just ask your younger siblings if you could chat to one of their primary school teachers for 10 minutes. They're very lovely people, and I'm sure they would, and they'll talk to you about their role. But also you can get on board and do things like, try and find some career information about becoming a primary school teacher, day in the life of a primary school teacher. There's lots of things that you can follow, Instagram accounts, particularly on, teacher recruitment websites and things like that. So, start exploring. Yes, you've got one bit of experience, but now go and try and find a few other bits as well. So, yeah.
Okay, I think we've managed to answer all the questions. Oh, sorry.
That's all right. We've done that one, I think.
We've done that one. So we'll finish up in 2 minutes. I just wanted to ask for both of you, to give me one key thing for students to take away. I'm going to say I want them to write a really authentic personal statement that is about them. So I don't want it to be really generic and like all the ones that you can find online. I want to know about them and what interests them and why they want to do the course. Rosie, what do you want to say?
I really want to see that students have done wider reading beyond the expected, beyond the social media, beyond the novella type books. What have you done to really know what you're signing up for when you want to come into a degree like this, and how that's going to help you to be successful?
Thanks to your dog as well.
I know.
I'm very sorry. She's noisy.
Sounds like she's having a good snore there. I would just add about hard evidence. So you just need to give evidence of things that you have done and things that ideally you have also done beyond the classroom. Yes, absolutely go down with the route of what you've read, like Rosie said, but also experiences that you've had, competitions that you might have entered, or, a group work project that you might have gone on to do, or charity work, volunteering. So hard evidence of things you've done. Reflect on them. Don't just report what you've done. Reflect on what you learned from them, and then link that onto your future career that you're applying for.
Fabulous. Thank you so much for joining us. I'm so glad we answered lots of questions. Hope everyone at home found it helpful. Don't forget to check in about 10-15 minutes for your files to download. So there'll be a copy of this PowerPoint. There'll be a handout on personal statements. There's a handout on choosing, like how to choose which degree to apply for, and there is the reading list as well. So thank you so much, everyone. Good night.
Thank you. Bye.